Hi, my name is Shelby Coneycamp, and I will be speaking on child and adolescent mental health. I'm informing my audience in order to educate them on how having child and adolescent mental health standards will help our society better understand the disorders prevalent in our society and to promote mental health among children. I want to show how not having standards, time span, and low-income mental health care affects our society. Also, I want to show the effects it could have on our society if we did have a policy. I'll be using credible sources to support why we should have these policies and the effects that the policies have. We are becoming accustomed to not having good child and adolescent mental health care. This is a huge problem because majority of children and adolescents never get to see a specialist because they don't meet certain requirements, don't have insurance, or they have to wait a year to see a specialist even if their case is severe. Some of these people aren't even concerned with their child's mental health because they don't think it needs treatment. The people who studied this in South London will tell you that most people don't ever go seek medical help for their child because they don't think it's necessary. We as a nation and world need to come together to help raise awareness for child and adolescent mental health so that we can have better services and understandings. We must inform families with children who have mental health to seek help and also try to set standards and create time limits for the healthcare facility. We also need to make sure that low-income families are able to get insurance to cover these medical expenses, as well as wealthy people. The first step we can take to change this is by setting standards for the mental health care facilities and their patients. I will be moving to the next slide, and I will speak about the statistics of mental health in children and adolescents in the U.S. According to Cheryl Katoka, Lily Zhang, and Kenneth Wells, 80% of all children have not received mental health care. 20% receive some of mental health care within a year. Latinos have the highest rate among all ethnicity because they don't have insurance. We can create clinics and inform policies. Insurance. In America, a lot of low-income people don't have any insurance to pay their medical bills. Reasons most people go undiagnosed for most of their lives because they don't have enough money to go get assessed for mental problems. Insurance companies need to add in a policy for mental health that costs the same as regular so that people will get diagnosed and treated. I will be moving on to the next slide, and I will be speaking about how much time it takes to... I will be moving on to the next slide. Just a second. Okay, sorry. I will be moving on to the next slide, and I will be talking about how long it takes to get an appointment for child and adolescent mental health assessments. According to Evans, child and adolescent appointments can take up to 12 months before they're able to be seen by a physician. This study took place in the United Kingdom, 176 cases waiting for initial assessment so they could be seen. He got the wait time down to a month, helping people get in and get initial assessments and be treated, which helped the wait list in the UK. If we got the wait list time down, more people would be able to go see a physician, and we'd have a better society because we'd be more diagnosed and have more information. Some families don't get answers for over a year because they have to wait for an opening, which can take up to a year. If we made a policy to make facilities have a timeline on how long they can hold a patient off, depending on severity, and get the severe kids in first, this will help most of the cases be looked at and treated. I will move on to the next slide, our last main point. I will be talking about how there should be standards in mental health care facilities. According to Cyril, Amar Singh, and Ravana, Coop, Ashworth, Day, and Simonoff, they tried to develop quality standards in the healthcare setting. They used 4 phases during the study, and they got to the Delphi process where they realized 10 out of 31 of the quality standards were important. In conclusion, they found that it is possible to get mental health care provision for child and adolescents, and they should be cautious of parental perspectives of the quality of care. We need quality standards in order to have the best mental health programs for children and adolescents. Quality standards will help mental programs grow in America. Will also help set standards that these primary care physicians have to stick to, keeping their programs uniformed and up to regulations. This will take me into my conclusion. I will go through the main points and the reason behind the persuasive presentation. Without the quality standards, the timeline for waiting, and the insurance to be able to see a physician, we would not have a good child and adolescent mental health policy. We need these in order to have a better society and understanding of the diagnosis and treatments. The next time you are at a physician's, I challenge you to ask them about mental health policies. Help us spread awareness on mental illnesses in children and adolescents. The next slide is my reference slide. If you have any questions and I do not have the answer, I will research. Thank you.